Hey everyone, welcome to the very first episode of Beyond the Dose, a podcast dedicated to bringing you a dose of reality on a topic very important to our generation.
We're your hosts, Anya, Risha, and Saloni, and our goal is to promote drug overdose prevention, clear the confusion around fentanyl, and help our peers make more informed decisions.
Today we're sitting down with a medical expert who sees the impact of these substances from a completely different perspective than we do. We are so honored to be joined by Dr. Harsha Bhootra, an anesthesiologist with over 20 years of experience in healthcare, to talk about what one pill can kill actually looks like from a medical perspective.
Dr. Bhootra, thank you so much for joining us. Now we have a few questions that we'd love to ask you.
Yeah, sure.
As an anesthesiologist, you work with powerful medications daily. Excess usage of fentanyl is becoming a big problem, especially amongst youth. So, what is your perspective about this opioid crisis?
Yeah, actually, we use fentanyl day in and day out. But here in India, we have a strict protocol. So, fentanyl is not easily accessible for anyone who wants it from over the counter. We need to take a license for which we have to give an exam. Then we have a drug controller where you have to go and you have to ask for their permission, and then you get fentanyl on your record. So we get fentanyl from the drug controller's permission, and everything is kept under a book. A register is made, and all the names of the patients which we are using fentanyl is to be added in that list. So I think here we have that transparency that we try that fentanyl is not used by anyone unauthorized.
That connects to another question that I had, which was like, what's the main difference between the controlled environment legal fentanyl that's being used and the illegally manufactured fentanyl that can be incorrectly put into pills?
Yeah, I think fentanyl is a very good drug if you use it wisely. Like we use it here in our practice in the operation theaters. So, to the main aim is to decrease the pain of the patient who is suffering. So, we need to make the youth aware that this is a very important drug which is to be used only on prescription and not to be used by anyone except the anesthesiologist. Even in like medical practice, not anyone is having that access and that knowledge of how much doses and when to use it. So it is now on you, the onus is on you, the youth of the world, that you should make use of the drug as a medicine and not as a recreational drug, because when you use it in overdoses it can cause bradycardia, means it will decrease your heart rate, it will decrease your blood pressure, and eventually it will decrease your breathing and then breathing difficulty, and then when excessive dose is there it can also cause death, and which is uncontrolled. So for that, to control all these things you need a medical expert. So it is better at a hand of a doctor or an anesthesiologist and not to be used by the youths alone.
Next, we wanted to ask more about the effects of fentanyl in the human body. You talked a little bit about it already, about how it stops the breathing. We wanted to ask, like, what is happening specifically to the heart and the lungs during an overdose, and how you might treat it in your hospital.
Like we use it in controlled manner, but by chance, if some overdose happens, we have an easy access to the ventilators and all the laryngoscopes, where if the patient stops breathing, we can directly go in and intubate the patient and take the control of the breathing in our hand. But this is not available except for the ORs or the emergency rooms. So, if something like this happens outside the hospital, you need to call the emergency. I think it's 911 in US, and take the help of the medical expert as soon as possible. Otherwise, the the person who has overdose is bound to die, either because of the respiratory failure or because of the cardiac failure, like the low heart rate and low blood pressure. If it is low heart rate and low blood pressure, it is going to eventually affect your brain. And then if the total brain shutdown happens, then the victim is going to die eventually.
And I had a question about that. I'm not sure if you mentioned it already, but are there accidental overdoses that can happen in the hospital? And if so, are there specific procedures that you practice very often? And is there anything special that you do specifically in a hospital that you may not have access to outside of that setting?
Yeah. Accidental overdose are bound to happen. So even when during our residency, when people teach, when the seniors teachers, we have a strict protocol to use a fentanyl syringe. Whenever you load a fentanyl, you have to label. You have to label what concentration you have loaded, and that syringe is to be kept and used immediately. And for the rest of the fentanyl which we have a fentanyl locker, opioid locker as we call it, and it is kept in a lock and key, and only one person is authorized to bring it from there. And whenever we bring it from there, we have a journal, we have a register to be maintained. We have to sign, like if I am the person who is using it, the anesthesiologist. So I have to sign that I have used this much fentanyl in this kind of patient, and everything is to be labeled. Because if it is not, accidentally, instead of taking another syringe, I may take a fentanyl syringe, and that may cause a catastrophe.
And so I think that kind of relates well with how it's very common outside of the hospital setting for people to accidentally overdose, especially in teenagers and younger people of younger age. So, do you know why people with younger brains and bodies are especially vulnerable to the effects of synthetic opioids like fentanyl?
Ideally, you should not use a opioid outside the hospital setting. At least here in India, I don't think we have that easy access to opioids. But yeah, like all the other addictions, because it causes a feel-good phenomenon in the initial period. Uh, People get attracted to fentanyl, and like just like alcohol. So when if you use two, three recreational drugs together, the harmful effects are going to manifest very easily and very fast. So it can lead to early death and dependency. And if you are a fentanyl dependent patient is a youth, so means that addiction cycle takes up, and then all your youth is wasted. And I think you just have one life, so better enjoy it with many other things instead of going in for addiction to all the drugs which are available.
So for people, this kind of segues into another question is whenever you're delivering drugs, if some patients want to avoid opioids and drugs entirely, to avoid that feeling or just because they're not like okay with it, then what are some ways that you manage pain for those patients?
Yeah, there are nowadays many multimodal analgesia available. There are many drugs which we use instead of opioids. So it's not like opioid is the only drug which causes the pain relief. There are many more. So if you use a basket of drugs, then patient is bound to get better. And there are many pains which are for which you don't 100% required opioid. With other medications, you can handle the pain easily. So nowadays, even we have started using opioid free anesthesia for the patient, even if the patient demands, and even if the patient doesn't demands in some cases.
And for younger people, what specific effects do drugs have, like the addictive, like properties of drugs on younger people and younger populations, like teenagers or young adults? And why is that so addictive for them to keep taking?
Actually, I think it's not just about opioid, but it's about everything else which you young blood is going through. There is a lot of hormonal changes going on. You seek independency. You want to just go out and explore. So sometimes it's the peer pressure which makes you take all these medications or any other kind of addictions. Sometimes it's just the adventurous part, and sometimes like when you, it's like you are playing a truth and dare game, and someone is telling you that now you dare using it, and once you use it for 2 3 times, it becomes an addiction, and you start liking it. So then it becomes a dependency, and then whole your life is gone into that part. So I think it's better that if the person like who for like for say one teenager, if he is having a strong mind, and he thinks that I know I will not touch all these things, even if it is a peer pressure or wherever I'm going, I should not feel left out, so I'm taking it. So if you do that, I think most of the youth and the teenagers who are just coming out into the open, they'll be safe, and they'll create a peaceful world around us. So that is the thing I think the teenagers and the young youths and even the older people should follow for themselves, because you cannot change the world, but you can change yourself. So better be confident enough to choose what you want to, instead of going in and giving your way into the peer pressure.
I think that's a really strong message that you have for people. And I was also wondering, for anybody who may suffer from an addiction to any opioids, do you have any advice for them to help them transition out of that addiction easily, or at
Yeah,
least either way?
yeah, there are, means even whenever you want help, whether it is of addiction, or whether you are feeling depressed, or whether you are feeling very low in the life, there are psychiatrists, there are psychologists who have wonderful programs for you. But for that you need to have that determination that I want to come out of this. If you don't have that determination to come out of that crisis, then no one in the world is going to help, can help you. But if you have that determination, no, I can do it, I can come out of the addiction, then there are a huge lot of people who can help you out. There are social workers, there are social psychologists, there are psychiatrists, and there are many programs going on which definitely are going to help you.
One of my last questions I wanted to ask, if you've seen any cases yourself personally, um and what they taught you.
Cases, I mean, of opioid dependency.
Uh Opioid dependency, overdosing, or maybe any addictive behaviors, because they can often transfer over. Just any
Yeah,
experiences in the field.
yeah. Like for whenever we get patient who is opioid dependent or any other addiction dependent, then the doses of the drugs which are required to anesthetize that patient, it increases tremendously. All the drugs, they have a side effect, and when the patient is already addicted to some of the drug like a opioid or alcohol or any other thing, then the effect of the drugs which we are going to use on the patient, that changes. So if we have that information beforehand that the patient is addicted to some drug, so we can manipulate or change the dosing of the drugs which we are using. Because if you are opioid dependent and I am going to give you opioid in the OR, so it is not going to have an effect, because you are already dependent on the a certain amount of drug. So we need to change our strategy accordingly. So if you should not be addicted to any drug, but if you are addicted and by chance you end up in the OR, you should say whatever you are addicted to your anesthesiologist, so that he can handle the case accordingly.
What steps do you take, or personally, or before you're delivering drugs to these patients in the OR? Or what do you do, or do you have any specific cases or experiences that you'd like to share with us, like from your time delivering drugs in the OR, or more about like your experience as an anesthesiologist in this field?
You know, I think fentanyl is a wonderful drug. Means I can vouch about it. if it is used in right quantity. Like when we give fentanyl, we have a protocol of investigations to be done before it, and after that, when the patient comes and all the investigations are okay, we go about starting our case. Fentanyl is a wonderful painkiller. So if you use wisely in a patient, maybe in a OR or in a post-operative cancer patients who require a longer duration of dosage, so we use it, but it should be used in a specific quantity. If there is a certain overdose, then over a period of time, the patient is going to have the side effects, and it is going to go into opioid dependency, and sometimes he may land up in respiratory failure, and he may uh, die because of it. So, but I really vouch for opioid to be used in a operation theater or in a closed medical center, but it should never be used for recreational purpose, as you teenagers might be facing the crisis here.
And I think one of our final questions that we have is um, lack of education is the first step to a fentanyl crisis. So, are
Yeah.
there any messages that you have to our viewers that you would like to give to help raise awareness?
I think whenever you are going out in a group, when I think whenever you are going out in a group, you should be firm enough to say no to all the peer pressure or whatever you are going through there. And you should choose wisely what you are going to have. Whether, and one more thing which I have not seen personally, but like in movies and in the TV serials, when you see that whenever someone is spiking your drink, you don't come to know. So better avoid having any drinks or any unknown medications when you're out with your friends. That will help a lot in avoiding all this fentanyl crisis that is going on. And self awareness and self motivation is the best thing you will have. And because it is your life, so you should decide, no, I don't want to go and try in this recreational phase of fentanyl, and of course the other alcohol and everything.
And the last question I wanted to ask you is what is your favorite way to get a natural dopamine boost outside of work instead of relying on these addictive drugs?
That is a very nice question. You have many. If you have any hobby, you can go for it. Some people get their dopamine kick by reading, some by dancing, some by going out on an adventure trip. And better not to stick to a television or a mobile phone. There is the world outside is very beautiful. So if you go out in the open with your friends, you play with your friends, or you go out alone, you like reading a book, you do that, or go on an adventure, that will be a perfect dopamine kick instead of going out and having all this illicit drug usage.
I think that was all the questions that I had. Anya and Saloni, do you guys have any more? No.
No, but thank you so much for sharing all your time and expertise with us today. This conversation has truly been a dose of reality for every student, parent, and a lot of members in our community today.
If you found value in today's episode, please help us spread the word. You can follow our journey on Instagram at dose.of.reality_HOSA and TikTok Dose of Reality HOSA, and find our full episodes on YouTube and Spotify. For our professional community, you can also connect with us on LinkedIn to see how we're making an impact in Austin. Remember, making an informed decision today protects your future tomorrow.
Once again, thank you all for tuning in today. Stay informed and stay safe.
Because the
the
smallest
smallest dose has the biggest impact.